Hello, I am Sylvia Azania, and if you are 29 weeks pregnant, you will be interested in this video. We will talk about the changes and measurements of the baby this week of pregnancy, the symptoms and discomforts in the mother, and we will give some advice. Additionally, we will answer some frequently asked questions. When the fetus reaches week 29 of development, it has already grown quite a bit, although it is still small. The baby's measurements are about 36 centimeters in length approximately and an average weight of 1,250 to 1,300 grams. In addition, the diameter of the fetus's head is around 72 millimeters and its femur measures about 56 millimeters. The fetus moves and feels comfortable in certain positions. It will become more common for it to position itself head down, which may cause the pregnant woman to feel more pressure in the lower abdomen or even in the cervix. The baby's lungs and muscles continue their maturation and development. Additionally, there is an increase in head size so that the brain can continue its development. At this stage of pregnancy, gum formation is also possible. The eyelids of the fetus open and close and eye movement occurs. Its skeleton is hardening. Other changes in the baby that take place in week 29 of pregnancy are the formation of red blood cells shifts from the spleen to the bone marrow. If the fetus is male, the testicles descend into the scrotum. The skin becomes pinker and smoother. The amount of vernix caseosa increases. Finally, the development of the immune system continues. The amount of antibodies transferred from the mother to the fetus through the placenta is increasing. And before we continue with the content of this video, I'm going to ask you, please, if you are enjoying it, to give it a like and subscribe to the channel if you haven't done so yet, because you help us continue and make the content we publish reach more people. When the mother reaches week 29 of pregnancy, she will likely notice that her internal organs are being pressed by the baby. The pressure is exerted on the liver, diaphragm, stomach, and intestines. Many pregnant women experience an increase in acidity and gas as pregnancy progresses due to the pressure exerted by the baby on these organs. The woman's breasts will enlarge and prepare for the moment of breastfeeding. Therefore, it may happen that the pregnant woman has slight spots of colostrum on her clothing. It is also possible for the woman to feel Braxton Hicks contractions in week 29 of pregnancy to prepare the uterus for the moment of delivery. As the size of the pregnant woman's belly increases, the mother will have more difficulty sleeping. For this reason, the woman may feel tired in the 29th week of pregnancy. Another consequence of the belly growing throughout pregnancy is swelling in the legs or lower back pain. Finally, nausea and vomiting are usually more common in the early weeks of pregnancy. Despite this, some women experience nausea in the 29th week as a result of having taken iron supplements for a long time or for another reason. Weight gain in women and an increase in belly size can cause problems with falling asleep and resting. For this reason, one recommendation would be to sleep on the side and use a pillow between the legs. This will help the pregnant woman to rest. Apart from resting, the woman should consider the diet to follow. At this stage of pregnancy, it is essential to consume foods rich in calcium, iron, and vitamin C. On the other hand, if the woman has not yet done so, the specialist may advise her to get vaccinated against whooping cough in the 29th week of pregnancy. This vaccine will help protect the baby as the mother's antibodies will pass through the placenta and breast milk. And now we are going to answer the most frequently asked questions about this topic. Is it normal to feel contractions at 29 weeks of pregnancy? Yes, but the contractions that occur at 29 weeks of pregnancy are not labor contractions. They are called Braxton Hicks contractions. These are mild contractions, so the woman will not feel much pain, although they can be uncomfortable, and they do not increase in frequency or intensity. The purpose of these contractions is to prepare the uterus for the time of labor. How is the baby positioned at 29 weeks of pregnancy? The baby's position at 29 weeks of pregnancy is likely already head down. This way, the baby is preparing in the correct position for when birth takes place. If the baby has not positioned itself this way yet, it will probably do so in the coming weeks of the 8th month of gestation. We would really like to know about your experience, so I encourage you to share it with us in the comments. I also remind you that in the tags and in the description, you have the link to an article where you can read more information about week 29 of pregnancy.